Section 8. Emotional Intelligence. This section includes Emotional Intelligence Overview and Skills, Developing Your Emotional Intelligence, Emotional Intelligence in the Workplace, and Emotional Intelligence for Conflict Management. What is Emotional Intelligence, or EI? Emotional intelligence is a group of competencies that influence the ability to respond to others and manage one's own feelings. It is the balance between our rational and emotional reactions, but unlike IQ, emotional intelligence can be learned and transferred into professional behavior. For example, when you are exposed to an event, you begin to have an emotional reaction even before your rational thoughts engage. By focusing continually on practicing new emotionally intelligent behaviors, you will eventually begin to respond to a situation more effectively. Emotional intelligence is one of the most important attributes of leadership, and using emotional intelligence can help healthcare providers improve communication, manage conflict effectively, and build a healthy work culture that fosters collaboration. Emotional intelligence has been defined as an array of emotional and social capabilities, competencies, and skills that influence one's ability to succeed in coping with environmental demands and pressures. Emotional intelligence includes interpersonal and communication skills, and healthcare providers can foster a culture of EI in their organizations to promote staff morale, healthy professional and therapeutic relationships, as well as positive outcomes for patients. When emotional intelligence competencies are ignored, work environments may be susceptible to disruptive behavior, from incivility to outright hostility. In healthcare, challenging situations often arise as relationships are strained due to competition for resources, recognition, or opportunity. Yet the same groups that are engaged in conflict over one issue often must collaborate with each other on other issues. Have you been in a situation where you had an intense emotional reaction, and when it was over thought, "I wish I hadn't said that"? Emotional intelligence is a powerful tool for building relationships, and most importantly, for repairing damaged relationships with colleagues or patients. Those skilled at identifying, regulating, understanding, and applying the principles of emotional intelligence are highly successful in communication, managing conflict, and preventing workplace violence. The first component of emotional intelligence is self-awareness that involves identifying, expressing, and managing your feelings. Self-awareness is a vital part of self-assessment, which leads to greater self-confidence. The next component is self-management, which means managing emotions and preventing yourself from acting without thinking. By controlling emotional impulses, we can communicate more effectively. Once you are self-aware and are able to manage your emotions, you can hone your skills of motivating others. Motivation involves understanding how feelings influence actions and includes how you perceive and react to stress. Empathy is the most emotionally intelligent skill healthcare providers must practice to be able to address social and emotional cues in others. By recognizing the cues that can trigger conflict in others and focusing on safeguarding common goals, you can more effectively communicate and de-escalate a situation. Social skills involves understanding how emotions are contagious and how to leverage the ripple effect of positive emotions. Let's look at each of these more closely. The skill of self-awareness consists of the ability to identify, express, and manage your own feelings. Self-awareness can improve decision-making because you are in tune with how you are feeling. Additionally, self-awareness is a vital part of self-assessment, which leads to greater self-confidence. Self-awareness means listening to your inner voice and connecting with your heart to ensure you're pursuing the right course of action. Practicing self-awareness can build an individual's self-esteem and confidence, helping them lead assertively and effectively. The skill of self-management consists of learning to manage your emotions and controlling impulsivity. The three emotions that are most difficult for us to control are typically anger, anxiety, and sadness. When we encounter a difficult emotion, such as anger, it is easy to become overwhelmed and act without thinking. Emotional agitation interferes with our ability to concentrate and make good decisions. Controlling the impulse to react results in more emotional stability and better coping with stress. Motivating others as a skill involves understanding how feelings and emotions influence actions and behavior, how to move someone to act. Optimism is one of the most important motivational abilities and is reflected in how we handle setbacks, obstacles, and stress in difficult situations. Motivation as an emotional intelligence skill includes our ability to handle rejection as well as perseverance. Self-reflection is an important way to deal with rejection. If we reflect on the feedback and focus on how we can improve in the future, it can motivate positive change. Empathy is an interpersonal skill, and it involves recognizing and understanding social and emotional cues in others. Most of the messages coming from another person are not in the words they say, but expressed in their tone of voice and their body language, posture, gestures, and facial expression. Empathy helps us stay on track and uphold the organization's, the team's, or the patient's goals and serves the greater good. If we are effective in using empathy, we begin to understand the person's original intent. Recognizing their intent and being aware of the behavior being exhibited can help us de-escalate a potential conflict situation. Social skills related to emotional intelligence include understanding how your emotions affect others and how you are affected by others' emotions. Realizing that emotions such as anger are contagious. Social skills involve knowing how to leverage the ripple effect of positive emotions, as this can prevent the poison of negative emotions. Leveraging positive emotions can result in increased cooperation, decreased conflict, and a more productive work environment. Often efforts are made to separate emotions from the workplace in favor of rational thinking. However, organizational culture is changing to recognize the independence of rationality and emotion. Our emotions influence our behavior and actions, as well as the behavior and actions of others. People carry emotions with them everywhere they go, and suppressed emotions can lead to social problems at work, such as isolation or anxiety, conflict, horizontal violence and bullying, or delinquency and aggression. Emotions are an always present contributing factor in every situation. A healthcare provider's ability to use emotional intelligence to effectively manage conflict and to stop workplace violence is central for healthy therapeutic and professional relationships, as well as improved health outcomes for patients. Any healthcare role can be enhanced by the development of emotional intelligence skills. Healthcare providers work in interdisciplinary teams to deliver care that meets the patient's needs. This means managing professional relationships with members of the interdisciplinary team while simultaneously managing therapeutic relationships with patients. When emotional intelligence competencies are ignored, work environments are susceptible to disruptive behavior, including incivility and outright hostility. Additionally, lack of emotional intelligence can be costly for organizations and patients. Poor application of emotional intelligence can harm the organization's reputation, patient care, and increase staff turnover. Emotional intelligence, unlike IQ, can be learned through changing your behavior and practice. It takes sustained effort, support, and an understanding of how the emotional brain works to improve your emotional intelligence. Developing your emotional intelligence requires a desire for self-improvement and a willingness to face personal shortcomings. Since developing emotional intelligence involves being aware of and addressing our feelings and behavior, often feedback about lacking emotional intelligence can be perceived as a personal slight. Therefore, creating an environment that is safe and non-judgmental while learning to develop emotional intelligence is fundamental. If someone is repeatedly overreacting or negatively affecting their work or the work of others, there are several strategies for managing conflict using emotional intelligence. First, address the problem with the person in private. ensuring you can both communicate clearly and thoughtfully. Use empathy and social skills to avoid putting the person on the defensive by speaking sensitively. Respectfully present convincing evidence of the problem with specific incidents and consequences, which may also include feedback from others. Make sure you provide the opportunity for the person to provide their perspective, and listen carefully when they are speaking. You may not agree with their perspective, but you do need to sincerely listen if you want to understand their viewpoint. Paraphrase what the person has told you to ensure you have heard them correctly. Ask the person for ways they think the situation can improve. Compare your perspectives, and remember that telling someone to change doesn't always work well if they are not part of the solution. Using an example of a positive, hopeful scenario can be helpful to support a solution and may help a person's actions change for the better. Lastly, the person should develop a plan with a specific goal. And if you are a team leader, you can support your colleagues with coaching, clear expectations, and positive work assignments. As a healthcare provider, collaborating with peers, patients, and families on setting mutual goals results in greater success. Strategies that facilitate the development of emotional intelligence can prove exceptionally helpful for healthcare providers to improve communication, to manage conflict effectively, and build a healthy work culture that fosters collaboration. Through self-awareness, self-management, motivation, empathy, and social skills, healthcare providers can effectively manage conflict and strengthen relationships in their personal and professional lives, as well as with their patients. Having self-awareness, self-control, and the ability to respond in an appropriate way to someone's emotions gives you the insight to know when to provide space or offer support. Using critical thinking to moderate emotions can result in more successful management of highly charged situations.